everyone, and welcome to Women's Health Tech Wednesdays. I am your host, Nina Joshi, and today I would like to formally introduce our guest, Dr. Essayei, who is an Associate Director at the Sloan Kettering Cancer Center. Thank you so much for being here, Dr. Essayei. How are you?
Good morning, afternoon, evening, wherever everyone is. I know you're on West Coast. I'm doing well, thank you.
Awesome. So excited to dive in and learn more about yourself and the amazing work that you're doing. So maybe as a place to start, would love if you could just, give us a background on yourself, your journey, what has led you to where you are right now.
Sure, that's my pleasure. First of all, thank you so much for having me. It's such a pleasure working with HITLAB. So I will start from the beginning as my journey has not been very much of a typical path. So I definitely want to share nuances and details. So I'm a physician by training. I did general surgery training in West Coast. I did my medical school overseas. And I am a futurist by mind, social activist by heart. So for the last several years in the professional space, I have been working in the digital health basically space, mostly strategizing solutions for the population health issues. I love to dive deep in, so on a micro level, but also on a macro level, so you can see the impact on the population, which is very important. And also I've been involved, and I am currently also involved with several projects overseas, globally, not only on my professional end, but also on social causes that are very near and dear to my heart, such as women's empowerment, primarily in the Eastern European countries.
Wow, that's incredible. Would love if you, I definitely want to dive into some of that work as well, but would love if you could talk a little bit more about kind of your current role and what you do at the at Sloan Kettering.
Yeah, so I will give some background because then I think it would make sense what my role is and where my focus is. As I said, it wasn't a typical path being trained as a physician. But I have to say, when I was in my training, I have observed for good and bad reasons, learning opportunities, I definitely observed that the balance between work and life, my mental health, my physical, and also career in general was very important to make sure, regardless of what people expect you to be, you need to be sure you're wherever you feel happy. Right. So I made a very difficult decision to decide where I want to go after my training years. And technology and digital world was very much attractive to me. I had a really great opportunities to work in a couple of small projects while I was in my surgery training. So I was very attracted to that space. But as I'm sure you all know, digital space is it's like an infinity, and no end to it, and you need to find your niche space. So I struggled for a couple of years to find the space within digital world that I would be truly bringing value to my patients. And the space that I got kind of into it, and then this is where I am right now, is clinical quality and patient safety. So in the traditional healthcare systems and healthcare practices, we do have obviously patient safety and clinical quality for centuries. It's not a new thing. But for digital space, that is relatively new and infant space that needs a lot of attention, and policies are being developed, best practices are being developed, and I thought that would be a space that I can bring value. And Sloan Kettering, again, my journey has not been easy, but definitely joining Sloan Kettering Cancer Center has been one of the brightest part of my career, and working as a associate director for the clinical quality and patient safety, was very much of a key because, again, specifically during COVID, our processes, operations were being, digitalized. We needed remote, providing remote care to our patients, etc. So I wanted to share that path has not been easy, but that's where I am now and happy with that influence.
That's amazing. And it seems like this is kind of a discipline where, like you had mentioned, it's always in evolution as new technologies start to develop and mature. So it seems like it's an area that, constantly needs a focused attention, and it seems like you'll never be bored, which is also good too.
Yes, definitely we're on our toes all the time, as you are in healthcare in general, but definitely keeping up with technology is another layer of ensuring you're on the top of it. With the issues that are, considering the issues that are right now in our reality regarding digital and AI world, we need to make sure our patients are, far from getting harmed and being harmed.
Absolutely. Yeah, would love. I know that you mentioned that you not only, do a lot of work in this space professionally, but also your passion when it comes to, social justice and awareness. Would love if you could share with us, what are some, when we think about, I would say, women's health or just healthcare in general, are there any particular areas that you really see kind of a need for attention and advocacy that kind of come top of mind to you?
Definitely. Yeah. Yeah. And I don't think I would necessarily surprise our audience, because the good news is they're being definitely brought up on different platforms. They're being talked about. However, definitely we need to go beyond talking and advocacy. We need to bring things into practice. So one of the aspects that I do want to stress is privacy, and specifically data privacy for women. Being protected by law to make decisions about your own body, health, and well-being absolutely is a key. And with the very unfortunate recent examples that we have seen, I'll bring some numbers in. And in 2019, we had almost 1/3 of American women using some kind of app to track their period, helping them predict their pregnancy days, etc. And all of these apps now, after the overturn of the Roe versus Wade, these apps now, once that they were helpful, now there is a risk of that they could harm our population in a way that the data that has been or is being stored could be hacked, could be sold, could be used for different reasons. So we have to be very careful, specifically data privacy in the areas that we don't necessarily agree by policies that are in practice right now, to protect our users.
Absolutely. That's such a huge component, especially when we think about how technology just continues to be more and more integrated in our lives. I remember kind of hearing about that too, and just thinking, as an average woman consumer, I never would have even thought that something that I relied so heavily on could be used in that way. So I think that's a really good call out.
Yep, definitely.
And also wanted to talk to you too, since I know you do a lot of work kind of globally, which is incredible. In the work that you do, especially, I know you mentioned some of like the Eastern European regions. What are some of the barriers that you're seeing when it comes to, I would imagine, accessing healthcare, quality healthcare? Would love if you could share a little bit of insight on that.
Definitely. I could talk about this for days, obviously. For the observations that I have done and work that I have been involved, I was fortunate to experience and observe things in firsthand. And I want to say the diversity of the practices that we see in US is mirroring what we see in the rest of the world. Meaning, we have in some states that certain laws allow more freedom for women's rights, women's practices for their health. But then for some other states, it's not much so. And the same thing we see in other part of the world, and particularly in my experience in Eastern European countries, involvement definitely I have observed that one of the big barriers is accessing to quality care. And when we're saying accessing to quality care, it doesn't mean necessarily there's no clinic for them to go. There are a lot of cultural and lack of education or limited education, limited awareness that even the clinic could be the next door with the best practitioners, but the cultural barriers limit your access to care. Again, not only cultural, but also your awareness of what do I need as a woman to maintain my well-being, physical, mental, and emotional well-being. And addressing those barriers is unfortunately taking way much longer time than if you would say, oh, access to care is, there's no clinic there and just we need to build a clinic, you know. So studying those environments that truly, is it accessing to the physical care is the matter, or there is a physical location for the care, but women, for multiple reasons, cultural practices, as I mentioned, they are not able to access the care.
Wow. And I mean, this may be, I know this is definitely not something that we can necessarily solve right here and now, but would love just your perspective. I mean, what are some of at least like the steps or kind of the building blocks that we can take to address some of those societal and cultural factors that can hinder this access, not only abroad, but I'm even thinking here as well, that that's also a problem. Do you kind of, have you noticed any particular insight or just at least places to start when it comes to this?
Absolutely. Yeah. Yes. So I think, first of all, as everything else, researching and exploring, categorizing those barriers explicitly is extremely important. Distinguishing between, is it the rest of the family's involvement in the decision-making of the woman's health, the barrier, or is it that the family is fine, they're letting the woman to be independent, but it's the woman who doesn't read enough or is not educated to do to take certain steps. So distinguishing those and identifying those barriers clearly is extremely important, so you can be, you know, targeting into that direction. And in most cases, unfortunately, we see a mix of the factors. One of the elements that I have definitely observed also, the financial independency of the women accessing care. Mostly it's not that they are directly being told what to do, but indirectly through controlling them financially or emotionally, they take ownership of the decision-making from women, and the family or the community make those decisions. Even also by the way of shame. One very recent example that it might be familiar to our audience is the COVID vaccine. It wasn't about the health of the woman, but it was the communities would encourage to not take that COVID vaccination for fertility reasons, and that it would prevent their fertility, or the baby would be born with disabilities, etc. So, and that has been definitely a significant recent experience that we have observed. Similar practice we have also observed in recent years with HPV vaccine or last decade, making barrier for younger, you know, women and teenage girls to make that decision that they need the vaccination. Of course, their parents are involved, but if the same parents is not doing COVID vaccination because of the fertility reasons, she's not gonna allow her daughter to get HPV. So it's like becoming this generational issue, unfortunately. So so I guess to summarize that, I want to say definitely it's important to do the research part of it very, very thoroughly. And one of the tools that has proven to be successful in terms of overcoming these barriers, cultural practices, is powerful penetration of education and awareness into this community. So I personally found it very very practical when there is an education behind any intervention.
Right.
It's practical because they do visit for their any other health related visits to the doctor. So that is an opportunity to not just say you need to do COVID vaccine, you need to do HPV vaccine, but truly providing that education, providing that awareness, providing the material and resources that are validated, trusted. It's so important to provide resources that are trusted by that community, because some communities don't relate to Western studies. They don't, they do studies in other people that are not like us. So it's very simple when you think about it, right? So using resources that are familiar to them or trusted is a very good way of bringing their awareness. And we have seen results with that.
That's amazing. That's such a good point around kind of meeting people where they're at and kind of, leveraging whether that's specific people's communities, et cetera, is where they already have a lot of vested trust into to kind of be that voice. Yeah. I think that's a really important point. Wow, that's so interesting.
Yeah, it is amazing work. It is, I guess, one thing that I am very fortunate that I went beyond my borders of, my community and my environment is exactly that you observe different barriers, different challenges for different environments, and that you couldn't even think about it. So that is why the practices that one community has may not necessarily be applicable for another community or another part of the world. So it's extremely important to do that research thoroughly, to do that observation before, it's not a still cut to say, you definitely need, you just need a COVID vaccine, but just going into that cultural nuances that how we need to provide and convey that message that this community needs COVID vaccine or HPV or anything else.
Right. Absolutely. I definitely want to dive into, I know you had mentioned kind of some of the drivers. I definitely want to pick your brain and dive into that a little bit more. But before that, I just had a random thought, but is there any, I know you mentioned like the HPV vaccine, right? COVID vaccine. Are there any specific health services, treatments, et cetera, that have been kind of particularly challenging for women to access, whether that is the stigma, whether that is, just lack of awareness, education, et cetera? Is there anything that kind of comes top of mind to you?
Definitely. And I would just categorize them as a larger group of vaccines because definitely, again, it comes from, this is another chain of thoughts that community has around women, right? Because they always associate women with fertility, next generation's health and well-being. They always think things that could have an impact to the next generation are matters that the rest of the community needs to decide or needs to be involved in the decision making. And we definitely see that challenge around vaccination, even in US, because communities, families think that because the woman is going to bring the next generation on, the decision around what is impacting their health for the next generation is a decision of the community, not the individual. So that definitely is a vaccines are definitely still a challenge for globally and also locally in US.
Wow. Yeah, that does not surprise me, unfortunately.
It is not, that is the sad part, that it's not surprising. Even, I think what is surprising is the element of seeing that resistancy within women who are educated, within communities that are educated and sophisticated. They understand the science behind it, they understand the best practices behind it. That is the most challenging part, I want to say, but those case scenarios we have seen also over time, I can't tell you why time heals in this case, but definitely we have seen that pivot for COVID, for example, right? At the beginning, there was much of a resistance and much of a communities withdrawing their children or women to do. But over time, obviously, also because there has been more and more studies backing the vaccines up, which is an important element for sure. Absolutely. It has to do with the decision making. So it hasn't been unnecessarily unreasonable at the beginning that we have seen the resistance, but over time, when there are enough studies for people to be comforted, also by their provider to be comforted and informed, that has changed the decision making for sure.
Absolutely. And that's actually such a great point. Would love to learn a little bit more, I think, about really kind of the role of a provider and kind of what they can do. I think we've seen it on both ends of providers being great advocates, as well as providers, minimizing and kind of having that relationship. So what do you think is kind of the role that a healthcare provider can play in, ensuring equitable access and, being an advocate?
Extremely important. Extremely important. When I was in practice, one of the things that I noticed, the privilege that a physician have beyond the physical care for the patient. We are seeing patients when the patient comes to us, that it could be one and only opportunity that that person has, that woman has, to expose herself if there anything outside of her body, physical health, that we need to notice. We could be a primary care physician, we could be a gynecologist, we could be surgeon, but we could observe things that are not for that session necessarily, but it should be included. And during my training at this, I have been trained that way. One of the things that was part of my training was when specifically women come to visit a provider, you have to pay attention to their body language, specifically to their, if there are any unreasonable marks on their body that could be sign of abuse, to be extremely more even so careful with women and female patients, just because of the risks. Unfortunately, we know 1 in a 3rd person, woman globally, unfortunately, still is being harmed and abused in different ways. So that is significant number. Again, region to region is different, but average WHO's numbers are so that it could be that one time that woman is coming to the to see their nurse physician, and if you miss that opportunity, that could be determinant of her destiny, could be.
Absolutely. Yeah, that's such a good point about really kind of the provider really being able to be like the eyes and ears and kind of making sure and playing that role. Absolutely.
Yeah. And they have the authority. They are physicians, so they definitely have the training to recognize the signs. Definitely they are trained to provide the treatment. If it needs to be, we have cases when we're in practice, we have cases that we need to report when regardless of the desire of the woman, we need to report, like physical abuse definitely is one of them. So that escalates. So we are that channel. We can escalate, we can bring up the issue as it's needed.
Absolutely. And something that I'm kind of curious about, because I know, where you sit, you really get to view technology and kind of see what's coming in the pipeline, so to speak. And, I think it's often been said that technology kind of can really be this way to provide access, to provide, education, information, all of that. Are there any particular things, whether it's, particular technologies that you're seeing or areas where that just are kind of exciting to you that you're seeing kind of coming in the pipeline? I know AI is a huge one, but are there any other interesting things that you're seeing that can really provide, benefit to women's health?
Absolutely. And there are so many of them, and they're growing, which is amazing. One of the apps that actually it was developed in one of the Eastern European countries. Now it's certified WHO app for women's health is well-being, I should say, is an app that helps women who are in a dangerous situation. It could be any kind of dangerous situation. They can make a call without even calling, actually, with certain touches on the phone. Even they can make that signal to the authorities that they're in danger. Specifically, if when they fill out their profile, they put in identify persons or person who could be prone to risk of domestic abuse of any kind. So it's easy access through that app, activation of that app to access care and help that they need. I was very impressed. I mean, there are so many similar apps, but I have been just exposed to that one a couple of years ago, which I thought it's vital for women to have access to something that it doesn't necessarily need to open your phone and then call the number and then someone needs to get info from you, but all of that steps have been taken care of through that app. So all you need to do is just touch on your phone, and even it has voice recognition from distance, so you don't need to necessarily touch your phone. Very powerful tools they're out there that, again, many tools for pregnancy tracking, period tracking, pregnancy timelines. So those are very powerful to make sure we're protecting our bodies and for unwanted or unplanned pregnancy. So definitely there are so many apps out there.
Which is amazing. I realized that we are 1 minute away. I don't know where the time went, but I know it's been such an amazing conversation, and really just wanted to ask you, which is my favorite question and way to close, is do you just have any words of advice for just whether it's women starting their career that are really interested in women's health and the work that you are doing, any words of advice that a mentor had given you that you want to share with us?
Definitely. Let me summarize it. So I would say this is what I would tell my daughter, who is now in my tummy. I'm pregnant.
Oh, wow. Congrats.
So thank you. So when she's born, I will tell her this, that, we came a long way for sure. We have a long way to go. But part of that long way to go is maintaining what has been done in the past. So if you are fortunate, privileged to be born and raised in an environment that women's freedom and equal rights is already in practice, please do your part to maintain those practices. Don't take it for granted. And if so, also, please try to reach out to communities who don't have those privileges, to part of the world where there is no such privilege. Help them to bring them to the equal rights for women and empower women in those regions. So I will just say that.
That's absolutely beautiful. Thank you so much for sharing that. And thank you so much for such an incredible conversation. We definitely need to do a part 2 to just dive into so many of the other amazing things that we were talking about.
Yeah. Thank you so much for having me.